Hello everyone, today I'm going to show you about linear and curvilinear calcification in differential diagnosis. So the key differential diagnosis issue, extremely common finding, key factor, location and pattern of calcification. Helpful clue for common diagnosis, atherosclerosis, follow expected course of blood vessel, C-type atherosclerosis, Monkeyberg atherosclerosis, atherosclerosis. Atherosclerosis, intimal plaques that narrow vessel lumen, cause auricular patchy calcification, mobility and motility with involvement of aorta major branch, coronary, cerebral, renal, iliac artery. Plaque can cause ulceration, thrombosis, and embolic complication. Monkeyberg atherosclerosis, calcification of middle layer of vessel wall media. Most common visible types of atherosclerosis on extremity radiograph. High stem or right railroad appearance with contiguous granular calcification. Medium-sized vessel involved. Common in patients with diabetes. No narrowing of vessel lumen. Atherosclerosis involves small artery and arterial cause wall thickening and lumen narrowing, predominantly affects kidneys. Venous insufficiency, platelets, small calcified thrombi, have central lucency, common in pelvic and leg. Soft tissue calcification of venous insufficiency located in subcutaneous tissue. Chondrocalcinosis, nonspecific cartilage calcification involve hyaline cartilage or fibrocartilage. Linear or lobular configuration depending on location. Common in knee, menisci, and articular cartilage, wrist, triangular fibrocartilage, symphysis pubis. Accompanying soft tissue calcification in joints, capsule, synovium, ligaments, and tendon, associated with numerous entities, calcium pyrophosphate deposit disease, modern growth, hemochromatosis, hyperparathyroidism, achronosis, alkalosis, acromegaly, vision disease, degenerative idiopathic cause. Eversion fracture, eversion of small contact fragment, donor size often not visible, type associated with history of trauma, size too numerous tools, size that herald more significant injury, major tibial rim, second fracture, associated anterior cruciate ligament ACL injury, fibula head evasion, associated ACL injury, posterior lateral corner injury, evasion about hip, in adult, always consider pathologic until proved otherwise. Most common is laser trachanter. Aneurysm, atherosclerotic mineralization outline larger than expected caliber for vessel on radiograph. Attention to aorta on chest, thoracic and lumbar study. Attention to popliteal artery on lateral knee radiogram. Other signs that may be seen on lumbar study, renal, hepatic, splenic artery aneurysm. Foreign body. Location variable, usually associated with story of puncture, no recall injury in patient with neuropathic disease, common in food. Fat necrosis, dystrophic calcification, most common secondary trauma, injection granulomas or subtypes, most common in bottom, rare diffuse fat necrosis, following pancreatitis. Soft tissue vascular lesion include varieties of hemangiomas, which are classified as neoplasm and slow growth, vascular malformation, soft tissue mass consisting of abnormal blood vessels, 7% of all benign soft tissue masses, usually intramuscular, curvilinear calcification of blood vessel, linear dystrophic calcification in thrombi, partially or completely calcified thrombin, ligament tendon calcification, early and tesophyte may appear as single line linear focus of calcification. Post-traumatic calcification may be linear. Reduced idiopathic skeletal hypostosis. Following anterior longitudinal ligament calcification or four or more contiguous vertebral body associated involvement of other ligament, either lumbar, sacrospinous, styloid, stylohyoid, often cause widespread rust-like endoscopy. Let's see the first example. This is the contrasting CT demonstrate force auricular calcification of the abdominal aorta that narrow the vessel lumen type of atherosclerosis, the most common form of atherosclerosis. This is the AP radiograph. Leg-like pattern of calcification is visible throughout the subcutaneous tissue. This pattern of calcification can be present in patients with venous insufficiency, but is less common than platelet formation. AP view demonstrate curvilinear chondrocalcinosis within the hyaline cartilage of the humerus, calcification of the acromioclavicular joint capsule is specific for calcium pyrophosphate dehydrate. Lateral view of the knee shows a small thin sliver of bone present in the anterior soft tissue. The patella is the first cephalad. This constellation of finding cause of patellar sleeve evasion injury, which occurred in young child. Non-contrasting CT demonstrate a partially calcified Celtic aneurysm, measure up to 6.3 cm. The rupture rate of aneurysm increased with enlarging maximal diameter. On this lateral graph, linear density are present in the soft tissue of the finger as the result of a pain gun injury. The cause of pressure pain is significant enough to penetrate skin and deliver pain into the soft tissue. This is CT of the palpable posterior chest muscle, two characteristic findings of the vascular malformation with several cleverly visible secant fat is distributed throughout the mass. Epi-radiographs show sacrotuberous ligament calcification in a patient with diffuse idiopathic skeletal hyperostosis. Sarcospinous ligament calcification may be present as well. Typical changes of diffuse idiopathic skeletal hyperostosis are present on these lateral radiographs following entry ligament ossification is present over multiple levels. The helpful clue for less common diagnosis. Scleroderma, elongated globular calcification, most common associated finding deep and deep erosion, soft tissue atrophy across all devices. Intra-articular body, very common but usually globular calcification or clearly bone. Syncotic of intra-articular bone body, sometimes seen in curvilinear on radiograph. Mositis ossificans. During maturation, mineralization begin at peripheral mass and is collinear. Lateral process mature to avoid bone. Dermatomyositis, erectile calcification with wide variety of appearance involves striated muscle, fascia, and skin. Can be extensive, involving trunks and extremity association, muscle atrophy, and or osteoporosis. Other findings include interstitial lung disease, esophageal dysmotility, sometimes seen with organoplasm in patients more than 50 years old. Soft tissue neoplasm, synovial sarcoma, especially low or extremity near joint calcification at periphery of mass. Chondrosarcoma ring and arch pattern of calcification chondroid matrix. Lipoma fine peripheral calcification rare. Lipoma with fibrosis metaplasia may encounter more dystrophic calcification. Hypercalcemic or hyperphosphatemia. Extensive clinical differential diagnosis, 90% due to hyperparathyroidism edema or malignancy. Differentiate with associated lab abnormality. Cartilage calcification caused by hyperparathyroid is most common carcinosis. Buddhist widespread seen calcification in dermal tissue. Calcified chronic deep vein thrombosis. Erectile calcification along venous distribution calcification can online thermal injury and burn. Find stipulinear calcification localized to area of injury or can extend it along in such a band. So this is the case of scleroderma. This is the case of antic intra-articular bone fragment and the bacosis. And this is the major of myositis ossificans.